Fitness professionals should be aware of the effects of extreme weather and environmental conditions on athletic performance, and, if ignored, can lead to adverse health consequences. The next several slides focus on hyperthermia and heat-related illnesses ranging from mild to severe. Hyperthermia is defined as an increase in body temperature caused by an overexposure to high heat and humidity. Temperatures higher than 80 degrees and humidity higher than 75% can cause heat stress. A mild form of heat stress is heat syncope. This occurs when blood pools in the extremities, resulting in dizziness and fainting. Treatment is to lay the athlete down in a cool environment, elevate the lower extremities, and have them consume cold fluids. Another mild form of heat illness is exertional heat cramps. Signs are painful muscle spasms, most commonly in the calves, thighs, or abdomen, caused by an electrolyte imbalance or dehydration. Dehydration can be caused by a lack of fluids, an infection, fever, or diarrhea. Treatment consists of replacing water and electrolytes and stretching with ice massage. Exertional heat exhaustion is considered a moderate form of heat illness and mild hyperthermia. Indications are profuse sweating, thirst, a pale face, dizziness, hyperventilation, headache, rapid pulse, fatigue, loss of coordination, vomiting, and a core temperature of 102. Treatment is to replace fluids and, if necessary, IV fluid replacement. Move them to a cool environment and immerse in cold water, or place ice on their head, neck, and armpits. Exertional heat stroke is a severe form of heat illness and defined as true hyperthermia. It is a serious, life-threatening emergency with an unknown cause. It presents with sudden collapse, loss of consciousness, flushed hot skin, minimal sweating, shallow breathing, a strong rapid pulse, and a core temperature of 104 or greater. Drastic measures must be taken to cool the athlete. Call 911 and immerse in cold water. There are 5 common methods used to prevent heat illness. Number 1 is to ensure fluid and electrolyte replacement before, during, and after exercise, and to monitor hydration levels via urine color and volume. Second is gradual acclimatization. Exercise should be progressed over a 7 to 10 day period to get accustomed to the heat. The third method is to identify susceptible individuals, especially ones with a history of heat illness. Bear in mind, medications and supplements may impair the body's ability to dissipate heat through sweating. Number 4 is keeping weight records. Keep a record of before and after weight measurements. A loss of 3 to 5% of body weight during a workout reduces blood volume, causes fatigue, and possibly mental confusion. The fifth and final method is uniform selection. Keep it lightweight and light-colored, and remove helmets or hats so the head can dissipate heat more effectively. Hypothermia is the opposite of hyperthermia. It is defined as a decrease in body temperature caused by low temperatures, wind, and dampness, also known as the chill factor. Signs include confusion, slurred speech, physical impairment, and exhaustion. Shivering aids in warming the body, but shivering stops when the body temperature drops below 85 to 90 degrees. And if the body temperature drops below 77 to 85 degrees, it can mean death. Treatment entails increasing fluid intake and rewarming the body externally and internally, with a possibility of The last environmental factor we will cover is safety in a lightning storm. Immediately get indoors, and if you can't, find a car, ditch, or valley. Avoid large trees, flag and light poles, standing water, and metal bleachers or cleats. If your hair stands up or your skin tingles, immediately drop to the ground in a ball. A good method to estimate the distance of a lightning storm is the flash to bang method. Count the seconds from the time lightning is seen to the sound of thunder. Divide these seconds by 5 to calculate the number of miles away. For example, 30 seconds divided by 5 equals 6 miles, and 6 miles indicates inherent danger and everyone should leave the area. You may return to the area 30 minutes after the last clap of thunder or lightning strike. To summarize, the fitness professional is often in a position to not only recognize an injury, but better yet, instruct their clients on proper techniques to avoid injury in the first place. Identifying common athletic injuries can help ensure a client seeks timely and appropriate medical care to minimize downtime from training, a benefit to the client and professional alike. Additionally, a fitness professional well-versed in the content of this module is poised to increase his or her client base, client referrals, and overall reputation in the field.